Welcome everyone to today's webinar, How OSF Leverages Digital to Empower Patients' Financial Experience. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a couple quick housekeeping instructions. We will begin today's webinar with a presentation, and we have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log in to today's webinar to access the recording. If at any time you don't see your slides moving or having trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I am pleased to welcome today's speakers, Laurie Hurwitz, Senior Vice President, Revenue Cycle at OSF Healthcare, and John Talaga, EVP and GM of Healthcare at Flywire. John and Laurie, thank you so much for being here today. With that, John, I'll turn the floor over to you.
Thanks, Taylor. And so great to be here. Especially honored to be spending some time with Laurie. Maybe get kicked off on the, the next slide, Taylor, if you can go there. Just a quick introduction, a brief introduction commercial on who Flywire is. We're a multi-vertical global payments company. I run the healthcare vertical for Flywire, which we work with over 80 healthcare systems, 4 out of the top 10 US health systems. And our mission in working with clients is to empower both patients as well as providers to resolve payments easily and on their own terms. If you go to the next slide, also wanted to just point out really the two really big problems in healthcare right now that Flywire, along with its customer partners, are solving. And one of those is healthcare affordability. We recently did a survey of over 2,000 patients that we published, of which a lot of good information, validated some things that we already knew and taught us some things that we were quite frankly surprised about. And one of those things on the affordability side is that 85% of the patients are concerned about rising medical costs. These are things that people, guarantors, families are thinking about. And one of those reasons is that 46% of the respondents can't even pay for an unexpected illness or surgery in one lump sum. They don't have the savings to be able to do it to cover their deductible. And then even in some cases more concerning is that almost 40% of those respondents have postponed a procedure or a treatment because they can't afford it. Exactly the thing that we don't want to do in terms of preventative care. The other thing that's driving is consumerism, where the demand for digital has been at its all-time high. And the pandemic has certainly exacerbated that need and that increase in digital as well. With this same survey that we did, 84% believe that the healthcare payment system needs to be streamlined. Probably not a surprise to anybody on this call, but these are coming from consumers that recognize it as well. And 77% want to pay for unexpected medical expenses in installments, and 55% said that they say that providers hardly any providers offer a consumer-friendly approach to billing. So we're trying to help change that. And if you go to the next slide, one of the things that I want to point out is that we have to remind ourselves that patients are consumers of all goods and services. And by and large, we've entered in what's known as a subscription economy, where it's commonplace for people to pay for things monthly, things like Netflix or Hulu, or even a digital subscription to the Wall Street Journal. And this subscription economy, as it's known, has recently propelled a growing trend known as buy now, pay later. And you can click the next slide there, Taylor, as well. And buy now, pay later helps consumers pay for common things that have a larger price tag, like a new washer and dryer, or you may have even seen recently that you can now pay for your airline ticket over time. And healthcare is no different for consumers. In fact, many will argue that even it's even more critical in healthcare to allow patients to pay over time, since medical expenses are very often unplanned, certainly necessary, and unbudgeted. So health systems need to really focus on, and many are more and more, OSF being one of them, need to leverage these trends by making payment plans a strategic advantage rather than what it's historically been, more of a tactic of last resort. And if you click the next slide, Taylor, I just wanted to hit on very quickly what we've seen and our product team has seen as really the pillars of what an effective digital engagement strategy really is. And you can just click through because this builds here, Taylor. First thing is we leverage machine learning to provide more personalized touch points. So what that means is using analytics, identifying patients' capacity to pay. So knowing who that patient is personally, rather than just send a bill with a balance due. We then look at taking and automating the engagement to create a personalized engagement strategy to drive adoption. Get the patient to take action, log into the EHR, create an account, put their card on file. Those are the things that we're using, whether it's email or it's text or it's chat or even paper, all those things coordinating together to be able to drive an engagement strategy that's very familiar to consumers in other industries. The third thing is providing a remote payment options for self-service. So when you identify their capacity to pay and you've engaged them, one of the key engagement points is giving them an amount that they're able to pay. If you go back to what we said earlier in the previous slide, that we have 46% of patients can't pay for the bill in one lump sum, giving them those payment options, being able to set up a payment plan or being able to pay with a discount, those are things that get the patient to actually take action. And then also enabling an instant communication for real-time answers to queries that might be chat and chatbot, eliminating the phone calls. Very few consumers like to call on the phone anymore. So being able to answer questions easily. And then, as I mentioned, deploying really the omni-channel messaging to meet patients where they are. So if you go to the next slide, want to just turn it over to Laurie now to talk a little bit about what she's been doing with her team at OSF. And one of the things is allowing patients to focus on getting well and keeping well and not what they owe. That's really what the importance of a good financial experience could result in, is they're coming to the hospital for care, not to deal with billing issues. So Laurie, turn it over to you to introduce OSF.
Hi, if we could go to the next slide, please. Hi there. So I am the Senior Vice President of OSF Healthcare. We're a Catholic healthcare organization headquartered in Central Illinois. We have 15 hospitals, 14 of them located throughout Central and Northern Illinois, and one in the Upper Peninsula of Michigan. We partnered with Flywire in 2016, looking for a better financial experience for our patients, looking for solutions that were going to meet patients where they were and offer them the experience that they expected they were going to have, which needed to include more than just you can send a check in the mail to us for your services and you better pay it off in 10 months. Next slide, please. Just a little bit about who OSF is so that you can get a sense of how you compare to us when you're thinking about yourself and the problems that you have and the solutions that you're looking for them. This is actually from fiscal year 2020, which means it hasn't been updated yet. We've acquired another hospital since then, so our numbers have changed. But anyway, off to the next slide. So this is a quote that somebody went and looked for from me from years and years ago. It's kind of disturbing, isn't it, that they can go find these things about us 5 or 6 years later. But my role as the Senior Vice President of this part of the health system is certainly to make sure that we do everything that we can to get paid every dime to which we are entitled for the services that we provide. But I also see my role as being that of a patient advocate, and it's just as important as the first part. This is an incredibly complicated, difficult, experience for most. Most people can't describe what their health benefit is. And I like to remind most of my staff that when patients come into our hospital, unless they're delivering a baby, they don't want to be there. They don't value that. That's not what they were looking for. And on top of that, it can be a little scary for them, particularly if they have a difficult diagnosis or a difficult treatment. So I believe it's our responsibility, since we do understand this, to help them get through to the other side where they're financially whole. They're not left with exorbitant payments they can't manage, nor is their credit damaged, and nor does an insurance company get out of paying for the part that they owe that the patient shouldn't have to. Next slide, please.
And by the way, Laurie, I think we have to take responsibility for pulling that wonderful quote, but we love the fact that you're saying you're a navigator and an advocate, because I think that's a great representation, I think, for what your role does. And by the way, leading to this next slide, what you were saying in terms of how VPs of revenue cycle, are managing this, leads us into what elements do you think are critical in supporting that overall vision. So like, maybe you can talk a little bit about the components that you need to have in place to ensure, what a good financial experience is.
Sure. So it's a couple of things. It's always people, process, and technology. That's always what it is. It's about constantly improving and adapting. It doesn't ever get done because the consumer's demands keep evolving. If you think about what your experiences were when you were getting services 10 years ago, 5 years ago, 3 years ago, a year and a half before the pandemic, or once the pandemic hit, they evolved over time and they became more demanding and more persnickety. With COVID, we all got used to, we could get whatever we wanted when we wanted it without really having to go anywhere. And we need to be constantly evolving and making sure that whatever our consumers' expectations are, that we're meeting them there. We could go to the next slide.
And just a quick transition comment, because the point you made is great. Consumer demands keep evolving. It really, as we say, it isn't enough to simply have an online portal anymore, right? We've talked about patient-friendly billing 2.0, kind of the next level, which is about using, these digital technologies to develop meaningful consumer experiences. And clearly OSF has done a great job of that. So you can share, kind of how you're currently using AI and machine learning to gain some of these better insights for your patients would be awesome.
Sure. So in the
Next slide.
past, I think that what most of us have done is we've relied upon credit scores and other tools like that to determine whether or not a patient is likely to pay their bill. But the truth is that credit scores are about patients making their mortgage payments, making their car payments, making their credit card payments. These are choices that they made for things that they wanted. And healthcare is different than that. And just because a person can make their house payment, their car payment, and their credit card payment, doesn't mean that they have the capacity to make a payment on an unexpected large bill that they weren't planning on. Because the truth is, most people live paycheck to paycheck. I think the latest statistic that I saw is something well over nearly 80% of most Americans are unable to make payments on bills that are much more than $400. And I don't know about your hospital system, but in mine, there aren't very many bills that are less than $400. So we're interested in looking at not necessarily the credit information, but understanding in the data that we've got, how do patients pay their bills? Do they pay their bills from what we know about them? Do they typically pay them in one lump sum? Do they typically need a payment plan? Do they usually default? All of that information is there. We just need a partner who can harvest that information for us and provide us with the intelligence that we need, and then match that with customized offers to the patients that based on what it is that we know about them. If we could move to the next slide. So it's also important to understand that not only do patient expectations change over time because of their experiences with other service providers, but their circumstances often change. So here we've got a great example of somebody who is employed, he's got commercial insurance, he's doing pretty well. He can probably manage a bill for about $3,000 when we look at what's going on in his life. But just a short year later, he's retired, he's living on a fixed income, he's on Medicare. He isn't going to be able to be paying as much as he did a year ago, or if we just go back and look at history. And then he winds up a few short months later having a car accident, which was totally unexpected. And so relying not just on the data that's in the payment history, but understanding what the life circumstances are as well to make sure that we make the right offer to patients. The next slide.
So one of the tremendous benefits of using AI is the way it empowers patients to take more active role in their financial well-being. And that's by encouraging self-service, which is something that certainly OSF is really focused on. So Laurie, it'd be great if you can share a little bit more on why getting patients to self-serve has become so important for you, and what are some of the principles that you think are necessary to get your patients to do it?
So first, we need to have a self-service option because that's what most of our patients want. Most of our patients don't want to talk to us on the phone. They don't want to send a check. They want something that's easy and fast while they're thinking about it, and they just want to get it done. Some patients do want to self-serve through an email and the internet. Others want to self-serve through a telephone IVR system, and either way, we need to have those available to them. It helps reduce our costs. The truth is that it's hard for us to staff right now. We're probably having the same staffing issues that you are that have been going on since COVID started. It's hard to hire, recruit, and retain people. It's expensive to have somebody answering the telephone. So if the patient doesn't want to do it and it's expensive for us, why would we not have self-serve? It lifts the demand off of staff on for the more common things, more common repetitive type questions, and it allows them to focus their attention on the patients that have more complex needs and to assist them. So then for self-service, for it to be effective, I think we have to really understand what it is that we're looking for, understand the end product, and then make sure that we design what we're looking for. It's got to be easy to use. If it's complicated, no one's going to use it. Most of our telephone triage systems are very complicated. And I'm sure I'm not the only one who at some point is yelling into the phone, let me talk to a person, because somebody has built a system that is so complicated, it looks like mousetrap, and it's impossible for me to get through. And at that point, it's just easier to send in the check or some other option that is probably more expensive. It's got to leverage the data to create a better experience. And it has to offer them solutions to their problems. It's fine, well and good to have a policy where you offer payment plans, but if you only allow payment plans to go out 10 months and the average patient owes you $3,000 and the average patient can only afford $200 a month, you've set up a system that's not going to work for you or for them. Next slide, please.
By the way, that's so true. And we thought we'd show this pie chart because it's a great example of what you can achieve when you put some of the components that we've been talking about into use. So Laurie, maybe you can walk us through what we're seeing here.
Sure. So we have many of our patients are actually just going and paying their payment online, the entire payment for what they owe. That's the majority. Then we have a lot of patients who are going out online and they're setting up and managing their own payment plan. And I think that's probably the second best outcome that we could probably have. Unfortunately, our third most common bucket, and this is all by volume, not by dollars, is staff assisting patients, patients still calling, setting up the payment plans. Now, admittedly, some of those are more complex, but some of them are not all that complex, and the patient doesn't want to have a credit card on record and they need to call us every month. And then the fourth most common way is for patients to pay over IVR. So we've been able to, by doing this, we've been able to reduce the number of staff that we need to have to answer the phone. We've been able, when we acquire additional hospitals and more volume, we've been able to do that without hiring anybody else to answer the phone, which has been great. It helps to reduce the cost to collect. Next slide.
I thought here we could dive a little bit deeper into, where those numbers are coming from, and maybe get into a little bit of OSF's digital strategy. And it's no surprise that email plays a significant role. And maybe you can tell us a little bit about the email side of things and why it's so important to your digital efforts.
Well, email is what's important now, but I'm not sure that's what's going to be most important in the next year or in the next 6 months, which again is why being able constantly monitoring and being able to evolve is very important. Lots of patients would prefer to get their statement in an email and then do something with it right then. They don't want to wait for their bill to come in the mail. That could take 7 days, and in a billing cycle of 28 days, you're using up 7 days of their planning time in the time that it takes to generate the bill, have it put into an envelope, stamped, and to go through the mail process. So patients like to receive an email statement. They like to be able to go look at it. Sometimes some patients just click on pay your bill now and they go do it and get that done. Others know that they're getting paid in 10 days and they'd like to make the payment in 10 days, or they're getting paid in 24 days and it's going to need to come out of that payment. And still others know that they're not going to be able to pay the whole thing at once. They'd like to set up a payment plan. So the email gives them added time and added flexibility. It helps us set the patients up to be successful in managing this themselves, and that we know that's what they want. I think that what's coming is more and more patients are going to prefer to get this information in a text message instead of an email, and we will certainly be taking a look at that and probably offering that next. Next slide. So this is what it looks like when our patients get an email. They open up their email, and this is on a looks to be on a computer screen. However, this is pretty much what it looks like on your phone or your tablet too. Personally, mine all gets done on the phone. I'm pretty lazy about this. I don't value spending any time on it, and I just want to be done with it pretty quickly. You get an email, you open it up, and it says your bill is ready for you to look at. It tells you how much it is. You can go in and you can click view the bill. And then you can, from there, once you can dial into the detail, if you want to look at the detail, you can set up a payment plan, or you can pay the entire thing in full. The payment plans that we offer are personalized. They're based on what we know about the patient, as well as how much the bill is. So for a patient that we know typically always pays in full, we just ask them to pay their bill in full. They can certainly set up a payment plan, but that's not what's offered in the first screen that they would see when they click on View My Bill. For patients that we know always set up a payment plan, and it's always for 4 payments. We know that, and that's what we offer them. We could go to the next slide, please. So this slide shows you what our success has looked like with our email engagement with our patients and what's happening with payments. So you can see over the course of the last year, we've been able to increase our conversion of payments where the patient gets an email, acts on the email and pays. That's gone up 63%, which is a pretty remarkable increase over the course of 1 year. When you look at what percent of the payments are driven by emails instead of by paper statements, we've gone from around 30% to almost 50% over the course of a year. So, and to me, what I see is terrific success in allowing patients more time to decide what it is that they are going to do or want to do, able to do, and also more success in reducing the cost to collect from them as they self-serve.
Excellent. So let's transition to talking about how you've been leveraging, AI-driven payment plans to make healthcare more affordable for your patients. So this has had a really a dramatic impact on the patient's abilities to self-serve. And why do you think that is? And maybe you just talk a little bit about your approach and strategy to that. Next slide, Taylor.
So we know that most patients want to pay their bills. There's a very small minority of patients that have absolutely no intention of ever paying their bills. But the amount that they owe winds up being a barrier for many of them, as the statistics that John showed earlier would indicate. So we know that if they want to pay their bill, but what they owe is too much for them to get paid, we've got to offer them some sort of option. So offering the payment plans into the self-service process allows them to do this with some dignity. And I think that's really important to recognize. Most people do not want to have to call somebody and say, I can't afford to pay what I owe. Most people find that to be a very uncomfortable conversation. I know that my father would be mortified if he had to call someone and tell them he couldn't afford to pay his bill. When I was very young, if I had a bill and I couldn't have paid, I'd have felt tremendous embarrassment telling somebody that. Self-serving takes that horrible feeling away for the patients too. And I think that's one of the intangibles here that we often don't really think about. Patients like to have the convenience of doing this however they want to. If they want to send a payment in, that's fine. If they want to take care of it themselves, that's fine. If they'd like to do it through the IVR, that's fine. But what we've seen is by giving them more options, we're collecting more. Patients are defaulting less. And the thing that I feel really good about, we're sending fewer of them off to collection. We're not damaging their credit. We're giving them the options that the collection agency was just offering to them anyway. Next slide, please. So again, we thought it would be good to show you what it looks like when they go in and they are going to go ahead and we're going to offer them a payment plan, because we know based on their past history and the amount that they're likely going to need a payment plan. And you can see how easy this looks. It really becomes simple for, now the patient can alter the suggested amount. There are lots of options that they've got, but the offer that we've made them is what we believe is the offer that is probably correct for them. Next slide.
So like with your digital strategy, we've seen in the past year really emphasize, how much patients are turning to these services. So do you want to take them through this slide and some of the stats from the payment plans?
Sure. So what you're looking at here is over time, over the last 3 years, what the trend has been for us in patients moving from complete reliance upon a person helping them to self-service. You can see we actually created a goal for ourselves to drive a lot more self-service. We were not really telling patients when they called that they could take care of this themselves. say, well, hello, Mrs. Hurwitz, thank you for calling. We're happy to set up a payment plan for you. And you can call back next month and we'll take your payments again. And, they forget, and then the plan, it goes into default, and none of that winds up being a good experience for the patient, nor is it terribly cost effective for us. So you can see that over the course of a year, better part of a year, we actually reduced by 8% the number of plans that we were having to have staff manage for the patients. And over time, it's been really remarkable how much the self-serve has grown. I think it's important to understand too, it's not in here, but the default rate when a patient self-serves goes down dramatically compared to when a patient is not self-serving. Go to the next slide.
And just one quick comment on that last slide on the defaults and self-serving is getting cards on file, right? So not just setting up a plan, but taking the first payment and then getting a card on file so the payments happen automatically, whether that's a credit card or their checking account information, which really helps with defaults.
Not just the credit card on file, but also having a process in place so that when a credit card expires, that we replace it with the known new expiration date or the known new card, which all of the clearinghouses can manage that for us back through our partner, so that we don't have to have the poor patient who's set up a payment plan and thinks they're good now has to call us and let us know what the new expiration date is on their card. That's been a nice win for us too.
Yes, awesome. So Laurie, let's wrap up with focusing on some of the key results and takeaways that you might want to share with the audience. So, one of the things we've really tried to, emphasize in this discussion is how utilizing these programs can lead to a better consumer experience for the patient and thereby, greater overall satisfaction with the billing and payment process. So I know you have some numbers and insights that you wanted to touch on here.
Yeah, so I think that this is really important. In healthcare, we've got the star ratings, and we know we have very long surveys that we send to patients and ask them to complete all about their care, but the financial care that patients receive, often they interact with us more than they do with their clinicians, which is sort of a shame when you think about it. And it's mostly because we've made the process so complicated, and we do need to uncomplicate that. So for all of the patients who make their payments online, I recognize that this is sort of self-selected and it may not be entirely, it certainly isn't scientific. However, for every patient that makes their payment online, we ask them to complete a survey, which is really just a quick question. We allow them to provide comments to us. We look at the comments all of the time, and we're trying to figure out where we have opportunities to improve. It allows us to fix things in real time, and I really appreciate that. That's not something that you typically get with some of the out-of-the-box solutions. The score, I feel really good about the score. 4.5 out of 5. That's a great score. I'd like it to be more like 4.9 out of 5, but 4.5 for a billing experience that is often complicated for a service that most patients didn't want to have, I think is a real win. So we keep our eye on this all of the time. I think it's critical. Next slide. And here you can see a summary of all of the metrics that we've talked about in the prior slides. Next slide, please.
Awesome. Thanks, Laurie. So just a kind of a key takeaway from some of the things that Laurie shared and we talked about is, I think we're hearing put the patient first, right? Patient's extremely important in terms of making that patient's first and last experience with your health system, strong, and then elevating the financial care. So thinking about prioritizing that higher. Certainly don't wait. I think what we hear often is, move forward because, if you believe in, as an organization that it's the right thing to do, then the only thing that the biggest risk you have is not doing anything. And then keep it simple, right? I think one of the things that we've really enjoyed working with the OSF team is, while there's lots of complexity that goes into the background of this, it's not simple. They're always pushing the solution to be as simple as possible for the patient. Have all the complexity on the back end, take care of it. And then the last one is keep the end in mind, right? Pay attention that the impact of your strategies and digital and everything really impacts the patient in the end. Laurie, anything else that you want to share before we wrap up and go to questions?
No, thank you.
Okay, thank you. Taylor, to you.
Fantastic. Thank you, John and Laurie, for a great presentation today. And now we will start the Q&A section of today's webinar. You can submit any questions you have by typing them into the Q&A box you see on your screen. With that, let's get started with our first question. We've all seen COVID accelerate and the need for digital, which you did a great job of highlighting here in the presentation. As we move into the future, how can hospitals stay ahead of this trend? And what new tools do you anticipate that patients will need? John, could you answer this one for us?
Yes. So, I can kind of speak from what we're doing with, clients around the country is that I think the thing that's accelerating the fastest and becoming the most important is probably adding chat and chatbot to the engagement platform. So, we talked earlier about how less and less patients want to call on the phone, right? And how self-service helps that, but they're going to have questions. And a lot of times those questions happen, at 10 p.m. at night when you're finally going through your bills. So having the ability to use chat. Now, if live agents aren't available, that's where chatbot comes in from an AI perspective, where it can have questions and understand what other questions have been answered in the past and be able to do that from a virtual assistance perspective. And then the other thing is don't think of chat as just a widget on the website. It could be a two-way interaction on text that an agent can be texting or chatting with their patient, or the bot can even do that two-way as well in text, or even virtual assistants. If you have Google or Alexa, where you can actually talk to the bot to answer those questions in any way the patient wants. So really meeting the patient where they are. I think that's what I would focus on. There's lots of other things, but that's probably the one that's been most impactful.
John, thank you for highlighting that. One more question to put your way. John, I recently saw that you were on a panel for Money 2020, where you talked about how healthcare payments can be easy as retail. What do you think are the biggest barriers preventing this, and how can we overcome them?
So it's interesting because when I was on that panel, I think one of the questions was, can it be like Square? Just go in and you swipe your card and it's easy. It's like, and my response to that, and this was less healthcare focused people in there, is so this is a little different answer here. My answer was, there is that capability today. If they're paying a copay or they're paying a simple payment at a physician office or even at the hospital, you can do that. The problem is not making it easy to swipe a card or make a payment. Payment is the result in healthcare. It's all the upfront stuff that we have to do to get the patient to pay. And I think a lot of that is moving up to the front end at pre-service and allowing payment plans and more payment options to be done with estimates at patient access, and then carrying that through to what we talked about today is engaging those patients with options they can afford. I also said at that panel, which I think people on this audience will appreciate, is the other thing is when you go to Target, you know what you're buying, right? And in healthcare, and when you're at Target, you're not under anesthesia when you're actually making those decisions. So it's different. Healthcare, we have to recognize the differences, and we have to address the problem and the technology very differently as well.
Thank you so much, John. It looks like we have time for one more question to sneak in here. So this audience member said, great patient response. We need to start surveying our patients like this. How often do you suggest reviewing what patients are saying to make sure that you're on the right track and delivering the services they want? Laurie, could you give some feedback with this one?
Right now, we're reviewing it monthly. We take we've got the survey results, but then we've got all of those comments. We take them, we try to categorize them, look for anything that indicates that there's a problem that we could fix. We attempt to trend them, see if if something needs to be addressed that we haven't thought of in the past. Our next step is going to probably be to start radioing these out so we can begin working them down a little bit more effectively. I think once a month is the absolute minimum. We just honestly don't have the capacity to look at this more frequently. Emphasize, I think it's hard to find trends over periods of time that are less than a month. Thanks for the question.
Thank you so much for walking us through that and giving the advice there. Unfortunately, that is all the time we have for today. I want to thank John and Laurie for their excellent presentation and Flywire for sponsoring today's webinar. To learn more about the content presented today, please check out the resource section on your webinar console and fill out the post-webinar survey. Thank you for joining us today, and we hope you have a wonderful afternoon. Thank you both.